questions you might have about prednisone, whether you've been taking it long term or short term, just a few days. Let me know what you want to know about prednisone. While we wait for people to arrive, I'll tell you my story so you understand why I even care to talk about prednisone. So, I personally had to take prednisone as a prescription for 9 months. And it was a miracle medication, and it was one of the most horrific experiences of my life. Let me tell you why. So, when I took prednisone, it was not when I expected it. There was no warning. Suddenly, one day out of nowhere, I was just a normal person, mother of a few young children, a pharmacist, online, and I suddenly got a rash. It was weird. I had little red dots along my neck. And then as the hours passed by, the red dots spread all the way down my body until the next morning they were showing up on my ankles. In addition, I had a little red bullseye on my arm here, and I had bruises that didn't hurt all over my body. It was really concerning to me because it was spreading. So it was not just like it had appeared everywhere. It was starting up top and going down. And so I was very scared, and I made an appointment with my dermatologist for the next morning. And the dermatologist said, "Hey, we don't really know what this is. We don't know if this is a side effect of a medication you've taken or if it's a disease that's showing up, but I was like, can you please just check my blood?" And they said, "Okay, fine, we'll check your blood." And when they did, they found that my blood levels of a really important thing called your platelets in your blood that helps with clotting was the normal range is 150 to 400. And in this situation, mine was testing at only 27. I was like, what is happening? And so they called and said, "Hey, we've got to do something. Go to your doctor." So I called my doctor and they're like, "Hey, if this is how bad it is, you just need to go straight to the emergency room." When I get to the emergency room, they retest my blood, and I'm now only at 3 platelets when the normal is 150 to 400. I'm at 3. That's a really big problem because if I don't get treatment immediately, I could literally bleed to death. I could get a blood problem in my brain and I would just bleed to death. That was really bad. So that's why I had to take prednisone. My hospital doctor said, if we don't get this in you now, you will die. Okay, good reason. So if you've had to take prednisone and you want to talk about it, just comment below. If you have any questions about prednisone, if you want to discuss what you're taking it for, I'd love to help answer them. If you have side effects you want to discuss, just comment below what your questions are. Leo says, "Ciao, como stai?" I don't speak Italian. I think that's Italian, but I think that means hello, how are you? I'm good. How are you, Leo? But that's just my guess based on Spanish. So I would love to hear what questions you have about prednisone. In the meantime, I can answer commonly asked questions that a lot of people deal with when it comes to prednisone. We have someone watching from Trinidad, and hello. So that's Donna Mae in Trinidad. Desislava says hi. Lovely. Thank you for joining. I'm so glad you could all be here live. So if you've taken prednisone, let me know what side effects you're worried about or wondering. Any tips I might be able to share to minimize your misery. So let's talk about some of the side effects I personally experienced, and then I'll share my tips of how to deal with it, unless anybody has any comments of questions they have about prednisone. So I personally had to take prednisone for 9 months, and it saved my life from bleeding to death, but it was a horrible, horrible experience. Some of the worst things for me was first, I had insomnia. And the insomnia from prednisone is the number one tweeted side effect of prednisone. Insomnia is awful because it makes you feel really lonely. Like you're the only person awake, everyone else in the world is asleep, and there you are fighting to sleep, but the prednisone's making you feel wired and like, I gotta do something. I have all the energy in the world and my mind is racing, going 100 miles an hour. Why sleep? That's how I felt, at least when I was on prednisone. Desislava says you're from Sweden? Is that Denmark? I don't know what flag that is, but I love it. Thank you for sharing where you're from. So when you have insomnia from prednisone, it totally makes sense because when you're taking prednisone, it is your cortisol hormone. It is replacing what your body normally uses to deal with disasters. Cortisol is designed by Mother Nature. I did guess Sweden. Sweet. It is Sweden. All right. Thank you, Desislava, coming from Sweden. My ancestors, a lot of them are from Sweden, so I have a very, soft place in my heart for Sweden. But back to insomnia with prednisone. It can be horrible. Oh, you have a question. Do you know what HDH is? I'm not sure what the acronym HDH stands for, but if you want to type out what it stands for, let me know. So insomnia from prednisone, I personally experienced, it was horrific. And the reason you get it is because instead of just a little bit of cortisol that your body normally is secreting to save you from disasters, we are taking a pill to replace it that is 10 or 100 times stronger. And cortisol normally goes low at night and is pretty much close to zero at night. But when you take prednisone, you're going off the charts and it doesn't quite let you relax and be able to fall asleep. Your brain and your body's thinking it's time to run away from a disaster. It's time to get away from this horrible thing that's happening. But there isn't really a horrible thing, right? It's really just your disease. So it's really hard because you have to take the drug like I did for my disease. I was going to bleed to death if I didn't take it. But the side effects of the insomnia can be so terrible. So that's the first one I personally experienced that I really worried about and dealt with. And some ways you can deal with that are, they did a study in a whole bunch of young, healthy men who had never taken prednisone before and didn't actually need it. It was just to see what happened. And when they gave it to them, they found that it completely turned off their ability to make sleep hormones like melatonin. So one thing you can do is replace melatonin. You can supplement it. You can take it as a pill, and you can do other things to help with sleep habits, like turning off your screen at night, at least 2 hours before bed, wearing blue light blocking glasses, getting first morning sunlight. Those are some really helpful things that can actually allow you to get restful sleep while on prednisone. How much melatonin? Awesome. So for melatonin supplementing while on prednisone, you can go anywhere from 0.5 to 20 milligrams of melatonin. And you'd want to start out low and go slow. So if you're on a low dose of prednisone, a low dose of melatonin makes perfect sense. If you're on a really high dose of prednisone, maybe higher, like 5 milligrams to start out with would make sense. So we've got a few people saying hi. Hi, Princess Olivia. Joe Gree says, how much melatonin? So awesome. Keep the comments coming. Keep your questions about prednisone coming. And for the melatonin, I personally recommend starting somewhere around 1 to 2 milligrams for most people. And then you can add on that if you need help. I personally created Nutranize Zone to help out with the side effects. And in my bedtime bottle, there's 1 milligram per capsule and you take 2 capsules. So my general recommendation for most people is 2 milligrams per day of melatonin. But it's possible to go up to 20 milligrams per day of melatonin if that's safe with your disease and with your doctor's permission. You always want to make sure that any supplement you take is appropriate according to your doctor. But just generally, 2 milligrams is what I recommend of melatonin. And what's great about Nutranize is it has all the nutrients that prednisone steals to help out dealing with side effects. And it's just one-time purchase for a 1-month supply, 2 in the morning and 2 at bedtime. You can get it on Amazon or my website, nutranize.com. So let's talk about some more side effects that I personally dealt with and that Nutranize can help with. So the next thing I really struggled with was I was at a normal healthy weight before that, but suddenly I was gaining weight from the prednisone. Who else has gained weight from the prednisone? Raise your hand. Comment below. Yes, what it felt like. The weight gain from prednisone is real. Don't let anybody tell you it's your fault. It is not your fault. It is the drug's fault. It is causing your hormones related to your metabolism to be thrown off completely. Back to that study of those healthy athletes who took dexamethasone or prednisone, they tested 300 different things in their blood, and more than half of those about their metabolism were thrown off completely. And so your ability to have a normal metabolism, half of the things that they can measure are thrown off. And so it's not your fault if you're gaining weight on prednisone. There is a good reason, because back to the fact that it's replacing cortisol, which is helping us by Mother Nature to survive disasters. It wants us to be able to hold on to the calories that we're able to access if there's a famine or a flood or a war. Like if you're able to eat, then eat as much as you can and just get it in and then keep running away. Survive this disaster. That's what Mother Nature wants. But if you're taking prednisone, there's nowhere to run to. Like you have your disease you're taking it for, and you don't need to run away. And so you're still having that pressure to eat and prioritize the worst foods. It makes you want to eat high carb, high salt, high fat foods. Think of Oreos. Like it's making you crave Oreos. And that's exactly what you should not be eating, right? Okay, we've gotten a few comments. All right, so 25 kilograms or 55 pounds is how much Joe Gree 2 has gained. Ranger says, hi. Donna Mae says, I'm definitely gaining weight. C-Rez says, I've gained at least 25 pounds. Started at 20, now down to 5 milligrams of prednisone, so that should really help. Donna Mae says, I'm GCA and unstable angina, waiting angiography. Oh my goodness, that is a tough time. Okay, all right, and then we have somebody wanting to know about MG. So I'll get to MG when I finish talking about metabolism and weight gain. So when you have prednisone, especially high doses, like those who are taking 20 or 40 or 60, that prednisone weight gain is real. And it is because that prednisone is making you crave the foods you should not eat. It's turning off the hormones that would make your hunger go away. Like, the GLP-1 agonists that are great for helping lose weight. Well, GLP-1, ghrelin, and other hormones are being turned off by the prednisone. No wonder you're gaining weight, right? And Donna Mae says she's started at 60, now down to 35. Yeah, that is super common with GCA. That is really a normal dose there. So what can you do about that prednisone weight gain? Do you just check yourself into a weight loss facility? Well, maybe if you have a lot of money, but there's better ways to deal with it. First of all, limiting what foods you have access to is really important. So cleaning out access to anything that you might crave while on prednisone, candy, desserts, sweets of any kind, white bread, just the simple carbohydrates that you're going to crave, just make them unavailable to yourself, right? Just make it harder to get access to them. Make it so you have to drive to buy the ice cream instead of just being able to pull it out of the freezer, right? While you're on prednisone, you need to take drastic measures to stop yourself to make it easy to succeed with your weight and your metabolism. So that's the first thing, is make it hard. Make it really hard to get access to the foods you know you shouldn't eat. Second, there's a secret about that metabolism, is that when you take prednisone, it is stealing nutrients from your body that would allow you to succeed in your cravings and keeping stable blood sugars. With the prednisone on board, you're more likely to have high blood sugar, high blood pressure, diabetes, weight gain, moon face, like belly weight gain, shrinkage of your arms and leg muscles. And that combination is so harmful to your metabolism and your risk for heart disease. So, those nutrients that prednisone is stealing, what if you just give them back? So one of them is called chromium. It is this metal mineral that you normally only need a little bit of, but prednisone makes you pee it out. And they did a study in Israel in the 1990s showing that if they gave back chromium to people who were taking prednisone who'd already been diagnosed with steroid-induced diabetes, like their metabolism was so awful, prednisone had caused diabetes, right? So they gave chromium, a special kind called chromium picolinate, to these people in Israel, and it reversed their diabetes. Wow, like that is amazing. So when you give back what prednisone is stealing, it can reverse those side effects. So if you give back chromium picolinate, 200 micrograms is the dose, then it can help stabilize your blood sugars, help you keep a healthy metabolism. That's one of my very favorite ingredients in Nutranize Zone, which you can find at nutranize.com or on Amazon. And it's really important to give back chromium picolinate. That is like, if that's the only supplement you take while on prednisone, that's really important. But that's not the one supplement that the doctors who prescribe prednisone the most recommend. They recommend that every person taking prednisone should take calcium and vitamin D, and that you should get your vitamin D levels checked to make sure how much vitamin D you need. These are the doctors who prescribe prednisone the most because they're rheumatologists, prescribing it for things like rheumatoid arthritis or PMR or GCA, lots of rheumatological conditions with lots of inflammation, people who need prednisone for a long time, and they want to prevent osteoporosis from happening for these people who have no other choice but to take prednisone long term. That might be you, it was me. And so they recommend giving back the calcium and vitamin D that prednisone is stealing. But if you've been paying attention health-wise recently, you know that you need more than just calcium and vitamin D. You also need vitamin K to make sure that the calcium doesn't harden your arteries, but goes to the bones. You also need magnesium and collagen and things like that to help support your bones, to keep them strong while on prednisone. So you definitely need to be supplementing with those as well. And that's another set of ingredients that I have in Nutranize Zone. Calcium, vitamin D, magnesium, vitamin K2, potassium, all of those things to help support your bones. Okay, let's answer some more questions. All right. Any advice on palpitations or PVCs that have occurred after a couple of months of cardiac workout already done? So yeah, palpitations, PVCs, arrhythmias, heart beating weird, jitteriness, all of that is super common when it comes to prednisone. Heart disease as a complication of prednisone treatment is 4 times more likely while on a person taking prednisone compared to a person who doesn't. So this is normal. If you had a full cardiac workout, then I'm assuming there's a cardiologist involved, and normally they're the best to answer this type of a question. But there are medications that can help stabilize your heart rate. Things like, they're called antiarrhythmic medications. And your cardiologist would definitely be the best, but some things like beta blockers, cardizem, diltiazem, those types of medications can support you and your heart while on prednisone and help support your blood pressure as well. Cardiac workup, yes. Yeah, I knew that. Workout, that works too. Okay, what I told the doctor that I'm cramping up feet and hand. I have shakiness, especially in the mornings. They've given you Tums. Great. Tums is a great first step in supporting your bones and your guts while on prednisone. It's just calcium carbonate, which is one ingredient that those doctors are recommending, but they also are recommending vitamin D And I'm recommending vitamin K2 and magnesium on top of that for full bone support. Back to the cramping of feet and hand. So often cramping, especially on prednisone, is due to low magnesium. You can test your magnesium, but like it's documented that prednisone causes low magnesium, and you need magnesium to be in the right balance for your muscles to not cramp up. So I personally take magnesium glycinate twice, 2 pills a day. You can take 2 to 4 or even 6 of them depending on your symptoms. If you take too much, you can kind of get diarrhea, but so you want to find what dose works for you. I personally take that, and I also include magnesium glycinate in Nutranize Zone. So it's the perfect thing for that as well. Okay, let's see. Amateur Calisthenics says you're in 2nd year of studying pharmacology. Awesome. I'm a doctor of pharmacy. I'm a board certified 3rd-generation pharmacist. So I got to take pharmacology classes as well. Several years of it. So that's fantastic. Can we have some advice to get high grades in the College of Pharmacy? Just do your homework, study, talk to your TAs, talk to your professors. Those are my best tips. It's just do the work. That's what I did. I had study partners, recorded my lectures, listened to them over and over again, took really good notes, summarized it, just good study habits. That's how I did it. Okay. I think there was another question I haven't answered yet. Oh, yes. I have MG. Please talk about that. Are you still here, Tabak? MG, I believe, in your situation, probably stands for myasthenia gravis, and it is a disease where there's issues with the acetylcholinesterase. Basically, a signal in your 2 neurons is not being sent properly, and it can cause like drooping eyelids, possible muscles of your throat or your lungs not working, just simply not working properly at all. And so prednisone is a common treatment for that. There are also other pills that your doctor can prescribe that can help minimize the symptoms of your MG. And taking Nutranize Zone along with it can really help out with the complications of treatment. Okay, let's see. You're here. Okay, had surgery 12/6/24 and started prednisone 1/1/25, 60 milligrams. Whew, good night. Okay, and now you're taking 15 milligrams every other day. So I have a question. How is the every other day going for you? Because some people do really well with every other day and other people really don't. Like on the other day when they're not taking anything, it can be really rough. Crypto says, you have MG and taking 20 milligrams of prednisone since May 7th of this year. I want to stop taking it. How should I stop? Can I go cold turkey? Okay, and Gazak says you're feeling like crap these 2 weeks. So that's what I've heard from most people who do every other day dosing, that they just feel horrible. So I would not personally do that if it were me. I'd ask my doctor for a different strategy. You could go to 15 milligrams every day, or even that out with 7.5 milligrams every day. Talk to your doctor, find out exactly what your doctor recommends, because most people just can't tolerate it. It's just that other day is just awful. Okay. Let's go back to Crypto's question. I want to stop taking prednisone. How should I stop? Can I go cold turkey? If you have been on prednisone since May 7th, you cannot go cold turkey. That is longer than the 10-day window. If you've taken prednisone less than 10 days, then it is acceptable for a person to stop taking it and go cold turkey. If it's beyond 10 days, you cannot go cold turkey. You must taper off. And the reason is, prednisone has been replacing cortisol in your body, and you will not be able to just turn on a light switch and suddenly start being able to make cortisol again. Your body needs time to slowly turn it on, like a sunrise slowly gets brighter over days to weeks to months. It's not a light switch. It's not instant. You have to taper. If you don't, you can go into adrenal crisis with multi-organ system failure and die. So do not go cold turkey is my number 1 tip. If you don't learn anything else from this live, please do not ever go cold turkey unless you've talked to your doctor about it and it's within 10 days. That's the only times. You must have your doctor's permission. You've got to be working with a doctor. This is life or death. This is not something we mess with. Okay, but how can you stop taking it? So step 1, talk to your doctor, say, I feel awful. Is there anything else I can do? And then the next thing that applies to every disease, every situation, is you should be on the lowest effective dose for your disease, for your personal body, your personal inflammation. For everybody, it's different. It depends on the size of your body, how long you've had it, and a lot of other complications that are unique to you. So I have no idea if 20 milligrams is your lowest effective dose, or if you could be on a lower dose. It's really, every single person is different. And so generally, I have a taper chart. My taper chart, you can just go to prednisonepharmacist.com and then go to the search box and say taper. It's a free PDF downloadable taper chart, and it has general taper charts. So like if you were to start out at 20, it'll show you how to slowly taper off and how to more rapidly taper off, like a 6-week versus 6-month or like 2-year taper. Those are kind of the general timelines. And so talk to your doctor, download my taper chart, print it off, and follow it. And when you're tapering, you want to taper by dropping 10 to 20% each drop. So if you're at 20 milligrams, %, would be 4 milligrams. So anywhere between 2.5 and 4 milligrams is an appropriate drop. So it's typically 20 to 17.5, or if you're really being aggressive, 20 down to 15. Those are possible drops for tapering. And the drops can be anywhere from every 3 days to 5 days to a week to a month. Depends on your body and how you're dealing with the taper. And then you could drop another 2.5 milligrams down to 12.5. And then you could drop down to 10, then 7.5, then 5, then 2.5, then off. And if you're really aggressive, you could kind of skip some of those drops in between. It's really dependent on your body and your discussion with your doctor. But that's the general strategy, is you drop by those amounts every basically week. Okay? All right, let's see what other questions. How should I do it? Taking 15 milligram daily for how long? So you want to take 15 for a week, 2 weeks, whatever, like whenever you're feeling okay, like you're not feeling exhausted, like you've got the flu, then do it for a week, and then 10 milligrams for like a week. You know, it's really slow and steady, very much listening to your body and your symptoms. Donna Mae says, I have been following you since July and I am striving to implement your advice. I don't have diabetes or high blood pressure. Awesome. I want to thank you for helping me and getting understanding. You're so welcome. I'm so glad you've been following me and that this has helped. This live has been sponsored by Nutranize Zone. You can get it at nutranize.com, Nutranize, or on Amazon in the United States. If you're international, then you can't get it there, and you'll have to take lots more pills to get the exact equivalent of what is here. But you can just find it out on the back. It'll probably cost you more than my all-in-one month supply inclusive supplement. You take 2 in the morning with your prednisone and 2 at bedtime, and it helps you feel better while taking prednisone. Thanks for joining me today. Signing off as Dr. Megan, your prednisone pharmacist.